So, hello, everyone. I think I know most of you on the call. I can see actually who's joined in, and I want to thank you all for joining in. This is your delegate, Mark Levine. Again, I apologize for not being with you, sharing a drink or eat. We hope days will eventually come back, and we will join us again at Los Tios, wherever we meet. I have been doing Mark's monthly meetups every month since 2015. This is the 5th year I've been doing them. This is, of course, my first virtual monthly meetup. So I apologize for that, but we all know the reason that it's happening. My guest today, for as much time as he'll allow, but he's very, very busy, is Dr. Stephen Haering. He is the director of the Alexandria Health Department. He has been doing yeoman's work, he and his team, as I said, working 12 to 16-hour days, 7 days a week, trying to keep all of Alexandria healthy. And I really want to thank him for taking a few moments to be with us today. So Dr. Haering, take it away. If you could just start out and let us know the situation. You don't need to sugarcoat it. Tell us how we are in Alexandria, what the threat is, what we should all be doing, and some of what your team is doing.
Sure. First, thank you for having us on. And I say us because I feel like it's not just me on, it's really my team that I am representing, because it's not just me doing 12 to 16-hour days. It's a team of public health nurses, epidemiologists, administrators, environmental health specialists, lots of different people, MRC volunteers that have really been working hard to help protect and promote health in Alexandria. We've been getting a lot of support from the city. Alexandria Health Department is an agency of the Virginia Department of Health, but the city treats us as a department, as a sister, if you will, and that is evident in a lot of ways. They've stood up the Emergency Operations Center, and our working connection with Department of Community and Human Services, with the Sheriff's Office, police, fire and EMS has really been very, very collaborative throughout this process. I want to give a couple of numbers, and some of these numbers are a day or two old, but globally, there have been over 500,000 cases, 571,000, with over 26,000 deaths globally. In the U.S., over 122,000 cases and over 2,000 deaths. Here in Virginia, I'm pulling up the numbers here. We've had 890 cases, 112 hospitalizations, and 22 deaths. And then here locally in Alexandria, we've had 28 cases. Now, some people might look at the Virginia Department of Health website, and we get a lot of questions about why are the numbers different here than what they are on the website that the city is hosting. And it's because there's a delay in the way the data is transferred. But for the most up-to-date information, the best place to go is alexandriava.gov/coronavirus for Alexandria residents. That would be the best source for what's going on here, as well as what the city is doing, what the Alexandria Health Department is doing. We've talked about, Delegate Levine and I have talked about my tech savviness and the limitations, and I see my power is low, so I've got to plug my computer, my little phone in here.
Why don't you plug your phone in, and I'll start getting the questions up to ask you, Doctor. Are you all plugged in? You ready to go?
I am. I'm going to be standing differently than I anticipated, but that's okay. If there's one thing we're learning about this coronavirus is things change quickly, and we have to be adaptable, and we have to just learn to go with the flow. You know, if your phone's not charged, stand somewhere else.
There you go. You're doing great.
And the same with the information that we're getting. We're constantly getting new information. You know, this is a brand new virus to the human species, so we don't know a whole lot about it. We've only known it since December 31st. We do know it acts similar to other coronaviruses. Some coronaviruses cause the common cold. Other coronaviruses have very high case fatality rates, and that means a large percentage of people who get the virus actually pass away from it. That would be SARS, and that would be the Middle East Respiratory Syndrome. This virus, we're still looking at the numbers globally and nationally. This virus, it looks to have a case fatality rate of 1 to 2%. So that means out of 100 people who get it, 1 or 2 will succumb to it, will actually pass away. The really unfortunate part is that there are subpopulations that are particularly affected, and that's the elderly population, those over 65, and especially those over 80. And then others who have what we call comorbid or underlying health conditions, such as heart disease, lung disease, or diabetes, also have a higher risk of having severe disease if they contract it. And we all know, because we know how this virus acts, we know the things that we need to do. Right now, we need to socially distance. We need to do exactly what you're doing, Delegate Levine, and that is stay home. Only go out for essential needs. If you need to go to the pharmacy, if you need to go to the grocery store, need to go to a medical visit, that is essential. Really, other than that, need to stay home, stay home, stay home. One of the questions we're getting a lot of is, how long is this social distancing going to go on? We're going to determine that, not just the Alexandria Health Department, and not just Virginia Department of Health, but we'll determine that nationally by looking at the data. And the data includes not just the number of cases, but also how is the infrastructure holding up. So we make our decisions not just on the number of cases, that's a very important aspect, but also how is the EMS system holding up? How are our dialysis centers, our long-term care facilities, our hospital? If not 12 weeks before things could start to normalize, and it could be even
Dr.
many
Haering,
months.
So people should expect that they'll be home for at least 6 weeks, and in quite all likelihood, possibly 3 months.
Possibly, but again, a lot of that's going to be determined by those multiple data sets, both the numbers that are coming in and also how's the infrastructure holding up.
So we've received a lot of questions about sort of the nature of the social distancing. And one of the questions is it okay to go running around Old Town? We have people that certainly want to exercise and want to get out of the house. Can they run so long as they avoid others, stay away from people? And Daniel Battisto writes that he does run, but he tries to avoid others on sidewalks, and most people reciprocate. Is that okay?
Absolutely. Daniel's doing the right thing by, keeping the 6-foot personal space around him away from others. Actually, getting out is a healthy thing to do. I think we all know what it's like to be indoors for a couple of days, and getting out, not socializing with people close, keeping your 6-foot distance is fine. Similarly, I think we had another question that was sent in that you sent to me is, if I go out with my household, so I go out with my spouse and daughter, and I also have family members from another house, but they're not in my household, can we get together with them? And right now, it would be best not to do so. It would be best just to stay with your spouse, your daughter, and not intermingle with others at this juncture.
And one of the reasons for that, I think, is because people can spread the virus even when they haven't had symptoms yet, right? I mean, from what I've heard from the people I've known, and I've talked to people who have COVID, it takes about 4 or 5 days for the virus, from the time they get it to the time the virus presents itself, usually, at least the ones I know who've had it. But in those 4 or 5 days, when people don't have symptoms, they're still contagious, right?
Well, this is one of the things we're still studying, and we still don't know a whole lot about at this juncture. We do know that the two coronaviruses, SARS and Middle East Respiratory Syndrome, they did not become infectious until the person's symptomatic. This one, we're believing it's when a person's symptomatic. But a lot of times a person doesn't know they're symptomatic because they might feel a little bit feverish, a little bit febrile, and just feel like, uncomfortable. Or they might have a little bit of a cough and they're not quite aware that they have the cough. So at this juncture, we believe you have to be symptomatic, but there could be down the line more evidence that it could be transmitted before we're symptomatic. So that's part of how social distancing will help us to stop this virus from being transmitted, from spreading from person to person.
Okay, Daniel has another question. He works for the Department of Defense. He says there's work in there he can't do from home, but he'd like to go in after hours when most people are gone. Lysol down shared areas, continue to wash his hands, not touch his face. Presumably, Dan's going to wipe down his computer, I assume, with a disinfectant. But once he does all that, is he safe to go to work, do the job he needs to do to protect us?
You know, in Daniel's in a similar situation as us. So a couple of other things to do. You're doing the right thing in terms of socially distancing by going in after hours. I'm presuming fewer people. If there are people during that time, then that would be a time for you to actually practice the social distancing within the department. So not be closer than 6 feet away. Now, there are certain ways that, you know, you just can't get around without touching a door and all. So make sure that you've washed your hands with soap and water for 20 seconds. If soap and water are not available, the hand gel with 60% alcohol or more after you've gone through those doors. And then
what about just wearing plastic gloves or a mask?
You know, the CDC does not recommend the general public to wear a mask. And there's a couple of reasons for that. One is that there is a shortage of masks right now. So we want to be able to use the mask where they're going to get the biggest bang for the buck. And I'll get into that in a minute. But secondly, the mask could give a false sense of security, and people would stop doing the other things that are important. Washing your hands, coughing or sneezing into your elbow, not into your hand. If you do cough or sneeze into your hand, using a tissue, throwing the tissue away afterwards, and then washing your hands. And then, you know, one of the most important things, and I can't overemphasize this, you know, we're socially distancing by telling everybody to stay home. It amazes me. And part of it is through nobody's fault. But it's astounding how many people still go out and have gone to work when they're sick. Part of it is because I completely understand, you know, a lot of people don't have sick leave. And, you know, they're holding 2 jobs or 3 jobs. And so they're kind of stuck. Do I not pay the mortgage or the rent, or do I go to work? But staying home when sick is so very important that everybody do that.
Yeah, I actually had a bill in a session for paid sick leave, but when Dr. Haering's gone, I'll talk more about what we did in the session. But that's certainly something I've been fighting for years. But the doctor's right. If you can stay home, please stay home. And if you're sick, you really should stay home. And there are things you can do. We'll talk a little bit about it after Dr. Haering's gone to make sure that you can get money and food during that time, so that really no one has to infect anyone else. There have been lots of questions, Dr. Haering, about tests. In fact, I get more questions on tests than on any other subjects. And so I'll just sort of read them one at a time. But Rod Kukro asks, simple question, how many COVID tests are available in Alexandria, and how does a person get one?
Right. The number of tests available, I'm not able to say, because the tests are actually done on the healthcare delivery side of the whole infrastructure, if you will. I do know that there are a number of practices that are offering it. So what I would suggest is calling your doctor, calling the urgent care centers, and calling Inova Alexandria Hospital. I'm pretty sure Inova Alexandria Hospital has up on their website that they are offering that. It requires a doctor's prescription, and they would screen people who are coming over to the hospital to determine if they meet criteria. So we're certainly not recommending tests at this point for anybody who is without symptoms. So you would have to have a fever, a cough, or shortness of breath. And then there's different labs that run the test. And because there's limitations at the state public health lab and even at the private labs, the private providers are using different sets of criteria to determine if somebody's eligible for testing. For state public health testing, for instance, we're using it for healthcare workers, for first responders like police, fire, EMS, and for people who live in a congregate living facility, for instance, a long-term care facility. And the reason for that is that we need to keep those government services running, and we need to protect those who are most vulnerable, those people who are in nursing homes and assisted living facilities. And then different doctors will have different criteria for what they'll use, but really it's physician discretion, if you will, in terms of how they will decide who gets a test and not.
So when Dr. Haering's gone, I'll share more of what I know about tests from the whole state side and from my conversations with the governor. I will briefly say now that there was a huge mess up at the federal level with regard to tests for 2 months. I'll talk about this more after Dr. Haering's gone. There are a limited number of tests, and so we're only saving them for the most severe cases. That is suboptimal. Let me be very, very clear. South Korea stopped its virus. They're actually having more people coming out of hospitals than going into them because they were able to test everyone. And that actually relates to Kathy Hoekstra's question, who writes that I've heard the reports that some people have had the virus, but it was so mild they don't realize they've had it or essentially asymptomatic during the time they had it. If this is true, how can we ever return to normal unless everyone is tested regularly, regardless of symptoms, since you can come into contact with an individual who's asymptomatic but contagious? Kathy, I agree with you. I'll get to Dr. Haering in a minute. I think eventually we're going to have to go to the South Korean model and test everyone, but we don't have enough. Basically, the federal government prevented both states and private companies from even doing tests. It's a long story. I'll tell you more about it after Dr. Haering's gone. Until a little less than 2 weeks ago, we're rushing to catch up. In Virginia, the government's doing it. It's Department of General Services. There's also 2 universities, University of Virginia, Commonwealth Virginia University, and there are 2 private companies, LabCorp and Quest, that are doing it. Unfortunately, LabCorp and Quest, when you send it out to them, it can take 4 to 6 days to get tests back. The state ones are quicker, but the sum and substance of it is we don't have enough tests. It's a huge flaw in the system. It's very dangerous. But the question I have for Dr. Haering is Kathy right that eventually, and I don't know what eventually is, a month, 2 months, 3 months, 4 months from now, when we have all the tests that we need, which we certainly don't have right now, that virtually anyone should be tested so that we can find out how far this is spreading. If we're ever going to end the quarantine, eventually the testing has to come first.
Very clearly we need more testing. Nobody's going to argue with that. The challenge, there's many challenges, and one is that if we had the capacity to test everybody in the National Capital Region, the challenge would be that that's a point in time. So it would tell us that if we tested everybody on Tuesday, that as of Tuesday they didn't have it, but then they could have caught it from somebody else on Wednesday while we're waiting for the test results to come back. So that's the first thing to think about. But actually, to have this much more widespread and to have the turnaround quicker, when we're getting results that are 5 to 7 days old, even 10 days old, we get a positive back. Well, that means the person hasn't known, and we're going back as a public health department and doing a contact tracing and finding out all the people that positive has been around in the past 10 days. Now, ideally, the doctors are telling people until your test results come back, isolate yourself, 100% isolate. But it's really a challenge from both a societal, from a individual and family perspective, but also from a public health perspective, how we deal with test results that A, are not widely available, and B, are not rapid turnaround. I do want to address another thing about this idea of returning to normal. I don't know that we're going to return to the old normal. In my 10 years here with Virginia Department of Health, we've dealt with H1N1, we've dealt with Zika, we've dealt with Ebola. We are in a global society, and the way we approach things really has to be different. I think our new normal will occur after we have a couple of things. And one is a safe, effective treatment for this. And the second
vaccine.
I'm talking about a medicine that if you have COVID-19, we do a quick test and can find out in 2 to 6 hours, and here, take this medicine that makes you feel better. But then the vaccine to prevent it. And
hold on, those are 2 separate things. When it comes to treatment, I thought a coronavirus, a bacterium, you can just take antibiotics. But when it comes to a virus, when I get the common cold, I just wait it out. Some colds are more severe than others, and obviously it doesn't affect my daily life like this would. But there is no cure for the common cold. That's they've been trying for thousands of years, I guess. Do we think there will actually be a cure for coronavirus as distinct from a vaccine?
Yes, there are studies underway right now. There are some antivirals that work. For instance, the trade name Tamiflu works against influenza. And influenza, of course, is a virus. So there's a number of other antivirals that work. The other thing that they're doing in some research centers is they're taking the serum or a part of the blood from people who have been known to have COVID-19, and they're distilling this serum, if you will, to get the active antibodies against the virus, and they're seeing if that works to treat people with severe disease. That's like really bad disease. You're in the intensive care type of treatment.
So how does this all play out? And I realize that I'm asking you to predict a future that's uncertain for everyone, but what are we looking at? You said a minimum 6 weeks, likely 12 weeks. When can we expect effective antiviral treatment or a vaccine or both?
I don't know about the antiviral treatment. I know the vaccine, they typically take 12 to 18 months. I know this is being fast-tracked at every level. This virus has only been in the United States public health labs since the middle of January. So, I would say the earliest we'll see something would be December, if January, but more likely, winter, spring, summer next year. So we're in this for the long haul.
For a vaccine. What about antiviral treatment? Could that be earlier?
Delegate Levine, it could be earlier, but I wouldn't know if that's a matter, how many months that's a matter of. I really do not know that information.
Okay, well, let's be frank. 12 months, December, all of 2020, that's optimistic as December. How are we going to live our lives? And again, just be honest with us. For the next 9 months, are we going to be cooped up at home, not working for 9 months unless we can telework?
Right. So the goal here is, you hear a lot about flatten the curve, and I'm going to see if I can make a curve here. So an epi curve when there's a pandemic.
While you're doing that, I need to plug in my own computer, so you keep talking.
Okay. So an epi curve is something that goes up really fast, and then it curves over, and typically it will go down. And what we're looking to do is, number one, not allow it to go up real fast, because there's a certain point, maybe about here, that you've exceeded the capacity of public health, EMS, the hospitals. So what we're trying to do is get that curve to go and curve over lower. And that's the idea of having people stay home. If we get enough of that curve to go back down, then we can go from the stage that we're in right now that's called community mitigation to a stage that we call contact and isolation, so that we find single cases. We find 1 to 3 at a time and isolate those people and all their contacts around them. Those are the efforts we're making right now at the health department. And it's the same thing that we do when there's any sort of communicable disease, say like tuberculosis. It's the same principle that we're applying. But what we've added as a society, as the governor and the city of Alexandria have done, is to also do the community mitigation strategy. People stay at home, gatherings are no greater than 10, essential services only, things like that.
So you think if we reach a point where we don't stop seeing new cases, or maybe the better example, South Korea, is where the number of people leaving the hospital is greater than the number of people going in, and we know we have enough ventilators, we have enough masks, we can treat it, then we can start to slowly remove the isolation, all making sure that basically the number of people who are ill don't go above what we can handle in our hospitals.
That's exactly right. So again, it's the numbers, but it's also the infrastructure, and how's the infrastructure responding to this? Now,
are most of us going to get this? I've been looking up the Great Flu pandemic of 1918, 1919. And again, sorry to give grim statistics, but these are the statistics. 500 million people in the world got that flu. It was 1/3, one out of every 3 human beings alive 100 years ago got the flu, and 10% of them died. So 50 million people died worldwide, 675,000 in the United States. Of course, we didn't practice the social isolation we're doing right now. Is this a disease? It's novel coronavirus that eventually, I don't know, 1/3 of us are going to eventually get?
Very likely. I've seen a lot of different models, and I think the thing about a respiratory transmission is that it transmits so much easier than, say, one that is
sexually
by other
transmitted
mechanisms. Yeah, sexually transmitted, close contact, foodborne, things like that, because this respiratory, it's much easier. At least it's not airborne, except under certain circumstances. In other words, it's not aerosolized. When we saw SARS,
do we know that? Because I know that most people, it seems, and I get it, by touching something. In other words, you touch a surface and then you touch your face. You don't wash your hands. That does seem to be how it's mostly transmitted. But can it also be in the air? I mean, if someone coughs in front of me, shouldn't I be concerned?
Right. Back to SARS, we knew it was easily aerosolized because people in the same building were getting it 3 and 4 floors away from each other. With this virus, it is, like you say, people, they shake hands, they touch a surface, they touch their nose, their eyes, their mouth, and that's how it's transmitted. Now, it can be aerosolized in certain circumstances, like you say, when somebody's coughing or sneezing, but also when, for instance, our EMS technicians are working on somebody and they're intubating somebody, or they're doing CPR.
Putting a ventilator into someone.
Exactly. Or doing a bronchoscopy, doing some sort of procedure. They're at higher risk. And, getting back to the idea of the mask, there's been the shortage of the N95 respirator mask, which helps to protect healthcare workers and our EMS technicians. And that's why they have to gear up fully. They put a goggles, face shield, mask, gloves, and gown on anytime that they're interacting with anybody.
Dr. Haering, there's a question from John Shiner. He thinks that he wonders if we have a false sense of security because we just don't have enough tests. So we only have 700 or so cases in Virginia right now, but there may be 7,000 cases because we just haven't tested. We're only testing the sickest among us. Do we have a false sense of security from the lack of tests?
I can't answer that directly. I can say that we want more tests. I can definitely say that our EMS and our hospitals are not being overrun at this point. And not that I'm anticipating that happening, but we are seeing the numbers go up. So it has us concerned, and we in public health are leaning forward about how we would handle or help the hospital, the healthcare delivery system, handle the mass surge that might happen if there's an increased number. In terms of the sense of security, we do know how it's transmitted. So when people follow the guidelines of staying home, then that's our sense of security. If people are really diligent about washing their hands when they are out, after they've been at the supermarket, after they've been at the pharmacy or their doctor's office, those are the things that actually provide the security that is very personal and very family, but also very controllable.
So, Dr. Haering, you say you're not anticipating the surge, but we see New York seems to be overwhelmed. If you've seen pictures from Elmhurst Hospital, Michigan, Louisiana, all across the country, we're seeing locally places that seem to be having trouble and their numbers are just going up. Could that be our future a week or two from now?
Well, we don't know that. Again, we're not seeing evidence of that at this point, but we don't wait for that. We're actually really working hard with Virginia Department of Health, with the Virginia Department of Emergency Management, with the city and our regional partners to prepare for medical surge. It's one of the things Inova Alexandria Hospital has done, in that they've built a system that they're calling I think it's called their alternate care unit, ACU, and it's a tent in which they are already, when people come over to the hospital, they screen them. And so the respiratory people go one way, the other people needing the emergency department go the other way, and that's going to help them to handle any increase in demand for healthcare services.
Gilly Campbell has a question. How should people who are elderly, let's say someone in their 80s, they need groceries, they need to eat, what should they do? How should they go about grocery shopping? Should they try to have it delivered to them? Should they go out with gloves? What's the best way for someone who's elderly and therefore most at risk to get the food they need to eat and survive?
Yes, that's a great question, and I really appreciate that. First is to use any of the social networks you have, whether it's a neighbor or a faith-based organization, and see what services they have available. Second is there's a lot of services that are promoted or advertised, if you will, on the website, the city website of alexandriava.gov/coronavirus. And then for Alexandria residents, we have an information line that I'm going to say twice here. It's the 703-746-4988, 746-4988. And if you call that line, the person answering it probably won't have the answer immediately, but they'll get you to the right resource to help you in terms of what the city has to offer.
So the city can deliver food to your door?
I don't know that the city itself is delivering food, but there's nonprofits. The city can
organize someone. If you need food delivered to your door, you can call that number, and the city will do its best to make sure someone actually brings you food to your door, particularly if you are elderly or in an immunocompromised situation.
Yes, and then that's correct. And then there's also there are grocery stores, and I can't say that I know of them locally right now, that are offering certain hours to be open just for people who are elderly and immunocompromised. And so calling the grocery stores, if you're of the ilk that you're still wanting to get out and do your own shopping, calling the grocery stores and asking them, is that available at your store?
And I think some of them deliver our grocery actually do deliver. I have another question, yes. Dr. Haering. Someone says, a person from Alexandria, I don't have the name in front of me, says at the March 18th, so it's 11 days ago, at the Emergency City Council meeting on the coronavirus, you were asked, Dr. Haering, by a council member, quote, do you have the resources you need to keep on top of the crisis, and what can council do to help? And you replied, we've been very stretched. We're short-staffed even on a good day. That was 11 days ago. Will your answer be any different if asked the same question today?
Well, I have been asked that question since then. And actually, I have made a request to the EOC, the Emergency Operations Center, and they're being responsive. There's a lot of talk about federal money coming down through the state. We're certainly looking forward to that, because when I look at the needs that we have right now, asking people to work 12 to 16-hour days is not difficult when we're doing a tuberculosis contact investigation at an elementary school, because I know that lasts about 2 weeks. And we're going on many, many weeks now, and we know that we're going to be doing this many, many more weeks. We're looking to the Virginia Department of Health, who might be reassigning other people or doing some of their work, some of the work that we're doing, and having them do it remotely. But yes, I am making requests. I do understand as of today, the Alexandria City Public Schools have offered some of their school nurses to help in our efforts, and that's going to be greatly appreciated. So we're looking at a lot of different angles.
Let me ask you this for an angle. I have constituents, in fact, I've had 3 now, 2 doctors and a nurse, who have said to me, hey, we're not be able to do what our normal job is for various reasons. We want to help. Can you take someone who's maybe not trained in public health, but is a doctor, is a nurse, is a medical provider, maybe an EMT? Can you use people if they volunteer their services to you?
Absolutely. We want them. And on that alexandriava.gov/coronavirus, scroll down to the MRC, the Medical Reserve Corps. That's our volunteer system. And I'll tell you right now, we could not do what we're doing right now if it wasn't for the MRC volunteers that are already assisting us. They're the ones that are running that. They're the ones running our info line. When you call the 4988 number, they answer the phone call. We give them scripts, we give them updates and briefings every day about the latest information and the latest things that they should be telling callers. And from there, the things that they can't answer, they pass it on to a public health nurse. But the MRC volunteer corps is very essential. I do need, if I could just limit it to 1 or 2 more, that
sure.
would be.
I'll just ask one last question, and I know you've got lots of work to do. We really appreciate you've actually spent more time than we expected, so really appreciate it. The last question has to do with mental health. This is a trying time for lots of people, and I know you're mostly dealing with physical epidemiological health. But how can people who are either depressed or God forbid, suicidal or are lonely or are just really stressed out by the very scary nature of this. Do you have any mental health advice for folks?
Absolutely. And thanks for asking that, because we look at health very broadly, not just physical health, but how mental and social health are. So there's lots of things to do. One is to focus on the things one can control. Focus on the things you can control. So you can control how you wash your hands, how you socially distance, how you help others to stay at home. Secondly, is to get out, but socially distance. Get out when the weather is nice and go for a walk. That physical exertion actually helps our mental attitude, our mental health. The next thing is there are resources on the coronavirus page that link to the CDC that provides a lot of good information about mental health. Actually, one of the things that we did here at the health department is we wrote some thank you cards to people that are supporting us and thinking about, okay, who's worse off than me? And maybe I'll write a note to somebody in a long-term care facility. I know that there's Alexandrians that have built a Facebook page, and they're actually coordinating this. Then finally, the Department of Community and Human Services offers crisis counseling, and that can be accessed through the City of Alexandria webpage.
Dr. Haering, I can't thank you enough for spending your time with us. I know you're very busy and you're working very, very hard. And Virginia thanks you for all your work. Folks, I'm going to hang up because Dr. Haering's got to go. I'm going to continue the monthly meetup. So once I say goodbye to Dr. Haering, what I'm going to ask you to do is I'm going to open up a new Facebook Live page. It's just going to be me, and that will let him go. So again, thank you, Dr. Haering, for all your help. Folks, what I want you to do now is I'm going to end this interview, and then I'm going to open up a new one within 60 seconds. Please join me there on the other side. Thank you again, Dr. Haering.